Hello, everyone. Thank you so much for joining us today for this webinar presented by our friends at Heroic Hearts Project. It's going to be a 2-hour course for facilitators using psychedelics, working with veterans. Um, it's, it, we're really excited to be helping to put this on. My name is Nico. I'm one of the co-founders of Alphia, and we work to support psychedelic facilitators, mostly in the regulated spaces in Oregon and Colorado. And of course, veterans are a population that can really benefit from psychedelics, which we'll hear a lot about today. And so we see a lot of that impact in our platform. I wanted to give a quick lay of the land of the platform that we're on with Crowdcast so we know how to use it. There's a bunch of people saying hello in the chat right now. That's amazing. It gives us a good sense of who's in the room. And I see a lot of people from Oregon and Colorado, which is beautiful, as well as from around the country and world. So it's a big, diverse group of folks who are joining us today. Lots of facilitators, lots of folks who work in the mental health space, who are interested in using psychedelics with their clients. So yeah, keep those introductions coming on there, and we can use that chat to continue to engage with the community. If you see on the right side, there's a question mark. For questions that come up during the presentation, click on that and ask your question there. And the reason why we want to put questions there is so they don't get drowned out in the chat. And we also will use the questions tab to allow you to vote up questions. So if there's a question that you really want to see the presenters answer, hit it with an upvote, and we'll try to get to the top questions first. The presentation today will come in a few different sections. And so we're going to try to address 1 or 2 questions after each of the sections, and then hopefully get to all the rest at the end. There's a lot of content that we want to cover, so we want to make sure that we have time to get through it and get to your questions afterwards. So yeah, use the platform in those ways, and I'll be sending some more instructions and reminders in the chat as new folks come in. Before we get started, I want to invite Tasha Poinsett from the Healing Advocacy Fund, who helped to get this event out to all of you as well, to share a little bit about what they're up to.
Hi, thank you so much, Nico, and hello, everyone. It's so wonderful to see so many of you joining us today for this training. So as Nico mentioned, my name is Tasha Poinsett. I am the director in Colorado of a nonprofit called the Healing Advocacy Fund. And really fundamentally, we are working in Oregon and Colorado to support the success of the state-regulated legal models for psilocybin therapy. And of course, looking to take the lessons learned from Colorado and support future states as well. As any of you know who've been involved in these programs, there's a lot of challenges, but there's also a huge amount of opportunity for healing, for growth, and for positive change. And so we really believe that what these programs need is support in these early days to overcome those challenges and to be able to grow into their full potential. And one of the core pieces of these programs is creating a foundation for training standards and for education around facilitation so that people can reach out to a licensed facilitator and kind of know what their background is, know a little bit about what they've gone through to be able to provide this support. And so that's why we're really excited to be partnering to share out this amazing free training today with Heroic Hearts Project. And just feel that fundamentally it's so important that people come with the skills and the knowledge to be able to support veterans. We know that veterans are going to be a significant population that's going to be continuing to seek access through the state programs, are also traveling abroad. And so we really thank you for coming out today to be a part of this, to gain new skills and knowledge. And I know that Ken and Jared are going to do a fantastic job. We are so thankful for the Heroic Hearts Project for all of the amazing work they do, both in direct services and care for veterans, and then also doing advocacy work to make these state-regulated programs a reality in the United States as soon as possible. So thank you so much. And with that, I'm going to hand it over to Ken and Jared. Thank you for being here.
Okay, let's get these slides going here. So without further ado, I want to welcome Ken Weingart to the stage, who is the Director of Training and Education and a clinical advisor at Heroic Hearts Project, as well as Jared Reinhardt, who is the Director of Coaching and Facilitation at the Heroic Hearts Project. And they're going to jump in and give you their intros and stories as well.
Thanks so much, Nico. We're so excited to be here with you guys today. And hopefully we'll all learn some things about veterans and psychedelic work. We'll start off with some introductions. I'm going to go first and then let Jared tell his story. I'm a licensed clinical psychologist here in Colorado. Oh, having trouble advancing my slides here. There we go. So I'm a licensed clinical psychologist. I've worked in the VA for about 20 years. I've previously been on the faculty at Stanford and Northwestern, doing mostly research on evidence-based psychotherapies for PTSD and substance use disorder. I've done a lot of work developing online clinical training for veterans and for clinicians who serve veterans. And I really pivoted, like many folks, I pivoted my career away from more traditional academic work and into the psychedelic field just a couple, 3 years ago. And I'm delighted to be working with the Heroic Hearts Project to develop some new training for our staff as well as the folks in the community. And just finally, I've become recently certified as a psychedelic facilitator through IPI, and I'm on track to become a clinical facilitator here in Colorado, where I'm located. So that's me. Let me move forward and turn it over to Jared to tell his story.
It is so good to be here and to be with everybody here to tell all about this. So I'm going to get into a little bit about me. I'm a Marine Corps veteran. I joined the Marine Corps back in 2006 and then was in an infantry unit and got out of the Marine Corps in 2011. When I got out of the military, that readjustment back into civilian life was, I will say, was it was the hardest adjustment I ever had to make in my entire life. Getting out of that structured environment and that type of mindset back into the civilian world. So much so that I was having drinking issues, substance abuse problems. I was going through a divorce. I living on couches in parents' houses and all kinds of things while I was trying to do my readjustment back into the civilian world. I couldn't really readjust that well, so I decided instead of getting into a normal job and trying to get back into the civilian world, I became a private military contractor for about 4 years. From that time frame, I spent most of that time in Iraq and Afghanistan. And then during that period of time, I started looking into psychedelics. And the one thing that I really landed on to really try that may have a lot of benefits was working with ayahuasca. So back in 2016, I drank ayahuasca for the first time in the traditional sense with the Shipibo tribe down in Pucallpa, Peru. And I'm sure, as most of you probably understand, that completely changed my perspective on reality, on life itself, on my life, my position in it, how I should treat people, how I shouldn't treat people, all kinds of things came from that very profound experience. So after that experience, I, believe it or not, decided to go back to my job as a contractor for about 10 months. I went back to Iraq and then integrated my experience back into my my everyday life out there. Surprisingly, I started making more friends. I started I took things less personal. And more importantly, I started working with the people that lived in the area, the Iraqis. I looked at them as people instead of Iraqis. I started looking at them as someone to understand and friends, as opposed to a possible enemy or a threat. And that alone changed so much for me in my context. So after that 10 months, I decided I just didn't really want to be a contractor anymore. And I didn't really know what to do. So I decided to go back to Peru and figure out what the next steps were. And from there, I started living in Pucallpa and was studying with the Shipibo tribe and facilitating ayahuasca ceremonies for about a year. At the end of that year, I was invited out to a retreat that was going to be hosted for veterans. And that's where I met the founder of Heroic Hearts, Jesse Gould, who we'll talk about a little bit here in a second. And I also met the love of my life, who's in the next room right now. And so that last retreat really set me up on a whole new path in my life. I had no idea I would be speaking to these people today. I had no idea I'd be helping run an organization or anything else. Jesse asked me if I wanted to be a part of this organization he just started called Heroic Hearts Project. And I said, anything I can do to help. And he asked me if I wanted to be a coach to help veterans get through all this experience, prepare and integrate. And I said, absolutely, I would love to do that. So I was the first and only coach for Heroic Hearts Project. And then now we are an organization filled with about 50 coaches, which I'm in charge of. And we have a very in-depth and robust program for integration and for preparation for our veterans going through it. So that's a little bit about me and my experience as I've gone through not just being a veteran, but my own psychedelic experience, and then building up into a life that I really enjoy of service and being able to give back. So I'll give it over to Ken. We can talk a little bit more about Heroic Hearts Project.
Let's do it. Thanks so much, Jared. So just top of the screen here, since 2017, HHP, Heroic Hearts Project, has connected over 1,100 veterans to psychedelic care outside of the U.S. And now one of the things we're doing, and one of the reasons we're excited to talk to you all today, is that we want to help thousands more veterans here on U.S. soil through licensed training programs and service centers, healing centers in Oregon, Colorado, and throughout the country as legalization kind of proceeds. Jared mentioned Jesse Gould, who was our leader. He's a former Army Ranger and was really plagued by severe PTSD for a number of years when he returned home from combat. So he quit his job as an investment banker, kind of got rid of all his possessions and wandered the world, ultimately finding himself in a ayahuasca retreat in the jungles of Peru. And to his surprise, he found that his symptoms of PTSD really disappeared after the retreat, and his life was forever changed. So he started this organization because he wanted to give fellow veterans a way to heal their PTSD that had worked for him. So Jared, do you want to add a little bit more? You've been here since the beginning of our organization. Any more history to offer?
It's really an organization for veterans by veterans, but it's really taken upon its own force at this point. Like we started as a humble group of about 4 of us, and now we have a pretty big team that we are involved in legislation. We're involved with moving things forward with education. We're deeply involved in the veteran community, and we've now, as he said, served just over 1,100 veterans, and then hopefully by the end of this year, that'll be just about 2,000 veterans by the end of this year. And we not only work domestically, which is a new thing actually for us since Oregon passed the laws and has started doing domestic retreats with psilocybin, but we've been working since 2017 with the indigenous tribes in Mexico and Peru to work with ayahuasca, psilocybin, and sometimes different medicines as we see fit for the veteran as we're moving through it.
Thanks, Jared. Just to give you a sense of what our HHP process is like, it should look pretty familiar to those of you who are psychedelic facilitators, right? We go through a pretty substantial application and screening process, and we're going to lead you through some of the questions we ask, some of the ways that we ensure our participants are appropriate and that they are safe to do the medicine work with us. There's a preparation phase that is largely driven by the coaches that Jared leads. And that's followed by a psychedelic retreat. And I would just point out that we use that term really broadly. It includes both the ceremony that's performed with the indigenous folks in South America, Central America, Mexico, and as well as more psychedelic-assisted therapy. So in that model of that many of us have been exposed to with the headphones and the eye shades and all that stuff. We don't do as much of that as the indigenous practice. That's really been our focus to date. And after the retreat, of course, there's the importance of integration, which again, Jared and the coaches lead. It's a pretty substantial coaching program with a longer term commitment to veterans so that they can make sense of and apply their experience with the medicine work to their daily lives. And finally, an important element of our program is that we continue to remain engaged with our alumni. In fact, some of our alumni, our participants, go forward and become coaches themselves, and ultimately will move forward into being facilitators as we develop additional training for them. Jared, anything else to ask about our process here?
You pretty much covered it really well. I would say that it's one of the things that we found with Heroic Hearts that is extremely important is we like working in groups. So a lot of the traditional sides that we're seeing in the West is that it's a one-on-one aspect with a therapist or or these kinds of things. But veterans do really well in group settings. We didn't deploy alone. We didn't join the military alone. Everything we did, we always had a buddy or a group with us in the military. And this has really been a big move forward when it comes to individual healing, because when they do have their experience, they also have a group of people that went through that experience together, and they can integrate together and they can work well together, especially leading up to the final step, which you see alumni creates a community for them of other veterans who have been through this similar experience that they can talk to about this or connect with in their own hometown, or maybe on a trip or something along those lines. So we find that the group cohesion is something that that really works well for us and is bared a lot of fruit in the field of healing for the veteran.
Thanks, Jared. Yeah, it's an important emphasis on group process and group work together. I'm going to give you a quick overview of all the other things we do at the Heroic Hearts Project. We kind of went through the psychedelic retreats that we run both internationally and domestically. I'll point out that we support a variety of research projects out of Imperial College in London, University of Colorado here in Boulder, and we're looking at the impacts of psychedelic treatments on all sorts of different outcomes, including symptom reduction, but also improvements in well-being and quality of life. We do a variety of education and training activities, including this opportunity here to speak with you all today, and just offer a veteran-informed perspective for coaches and facilitators, which is really our purpose here. We have an organization that's part of us called Healing Breakthrough. This is a federal advocacy program that focuses on MDMA for PTSD, primarily advocating for getting that resource available to veterans through the Department of Veterans Affairs. And then finally, last but certainly not least, we include the Hope Project in our portfolio of programs, and that really is designed to provide community and direct care to veterans, spouses, families, and caregivers who are often overlooked in this kind of ecosystem. So that's kind of the lay of the land in terms of our organization and the things we do other than providing and supporting retreats for veterans, as well as spouses and caregivers. Moving forward, just to give you a kind of a frame on what our partnership is about, what we bring to the table are folks like Jared, veteran coaches and facilitators. We bring trainers and educators such as myself, and we bring our experience, both international and domestic, in terms of running these retreats. What you bring to the table is as psychedelic facilitators, are that you have training and experience in medicine work. So we're in no way going to try to teach you how to be a facilitator in 2 hours. What we're really going to emphasize is the aspects of applying the tools that you have learned to the veteran population and some of the unique challenges and opportunities that lie therein. You'll see that we're very open. I'm sure many of you do trauma-informed work, which is fabulous, and hopefully what we are able to offer today will complement what you know already. Some of you may have a license or clinical credential, others do not. But basically, we're trying to educate and inform anyone who wants to learn more about how to do medicine work with veterans. That's really our partnership with Healing Advocacy Fund, with Althea, and the other organizations that we work with. So with that, I'll kind of go on and give you a lay of the land in terms of our agenda for today, and then I'll turn it over to Jared to talk about military culture and values. So we're gonna start off with that, just to ground ourselves in, like, what is it like to be in the military? What are some of the values that can really help people in psychedelic-assisted therapy as well as hinder them? Then we're going to turn the page and talk about PTSD in veterans, including diagnosis, assessment, and current therapies, as well as some of the specific challenges that working with veterans with PTSD present to the psychedelic facilitator. And then finally, we're going to talk about how do you do this, and how do you advocate for and support the delivery of psychedelic-assisted therapy and medicine work that will address issues of, or sensitive to issues of trust or lack thereof, veteran diversity, some of the military context that they're operating in, and how that can affect their experience in psychedelic therapy. And I'll let you read the rest of them there, but we're going to do a deep dive into some of the things that really make working with veterans with psychedelics a unique experience. So with that, I'm going to turn it over to Jared, and who can tell us a little bit about military and veteran culture.
Thanks, Ken. So a broad overview of military culture. I'm going to do the best I can with the time that we have. It can be very nuanced, but at the same time, there are some overarching themes that do cross branches and cross jobs within the military itself. And what I first want to talk to you about is the mission mindset. And if you can go to the next slide, please, Ken. So mission mindset, that is something that has been trained with military culture since basically boot camp, since the beginning. Right when they step in there, they start to understand what what mission mindset is. So I'm going to explain to you a little bit about it. Mission mindset is pretty simple. I think you can understand even if you don't know about the military. Mission and job comes first. So what that means to the individual is that your personal problems, your personal health, your emotions, your pain, your everything, that comes second when it comes to accomplishing the mission, because not only does the mission take paramount because of people's lives are at risk, but your country's mission moving forward is paramount, moving into whatever that command or whatever the motive behind your mission is. So you are just a tool moving forward into that space. So what does that look like for us as people trying to help veterans who are now not in the military, but they still have this same mission mindset? So a veteran doesn't just like let go of this and go, oh, I'm out of my job now, so I don't have to do this anymore. They come home and they still have the same mission mindset. And what this can look like is that like my personal problems, my pain, my emotional issues, my own individuality, all those kind of things come second when it comes to my job, my family, my community, my everything. That means they come second to everything that they would feel like is a bigger picture in their own life. So that means they may not be the first ones to tell you when something's going on. They don't normally come forward unless there's a crisis happening. They may pretend like everything is fine when everything is not fine. You may ask them how they're doing and they'll downplay their symptoms because they don't want to look like they're a liability or something that is that's going to jeopardize the whole of what's going on. Like I'm a good father, but I have these problems and I can still make it. I'm a good worker. I may have back problems or I may have PTSD, but I can still do my job really well. They downplay what's going on and not communicate around them, because while we were in the military, communicating these symptoms, for instance, to give you an example, special operations guys would avoid going to see mental health practitioners because all of them would probably be diagnosed with PTSD or some sort of thing after a combat deployment. And if it was serious enough, they would be non-deployable, which means that their job would be open in their unit and they would have to fill it with somebody else. Their friends would go down range without them, and everything would just be, and they would feel like they're jeopardizing their friends' lives in the mission by just expressing that they're having their own personal problems. So mission mindset is something I think that we really need to look at as far as when we work with veterans one-on-one. Can you go to the next slide, please? So a lot of what we're working with when it comes to like the veteran culture itself is like how do we work with that? So as you all may know, working with a veteran can be difficult because a lot of times they don't open up to people who aren't veterans, who don't understand. So one of the ways I try to I kind of work with this as a coach, even though I am a veteran, is first of all treat them like a person. And I know that seems really obvious, but I mean, when you have subconscious biases or other things you may think of what a veteran is or what this person may have been through, that locks that person into that belief system or into a role structure. And they can start feeling that on a very subtle level, and they might push against that. So there's no need to recognize their service or talk to them about asking them a bunch of military questions. If you don't know what's going on, let them be the ones to explain it to you if they feel open to do so. This is a person coming to you to treat their own personal stuff, and it has very little to do with their military mindset, even though that may be what's getting in the way of their own personal healing. So I just point that out. Don't bring it up unless the client brings it up. So, and there's no need for you to even do research about this kind of stuff. Let them express what's going on with their own military expression. There's no need for you to watch a bunch of war movies or read a bunch of books about like what it is like to be in the military. They will tell you, I promise. And then if you have the language, if you know how these people talk to each other, I recommend using it. Come down and meet them where they're at. So if they're using things, if I like to say, like, because I was in the infantry, I can talk with infantry guys or people that were in the infantry on a level, because I can speak that language. I can give those references, those analogies that they may understand. Veterans, they really like direct feedback, and if they feel like you're kind of beating around the bush, a radar goes up in their head that you're not being upfront and honest with them. We do really well with direct feedback, and that's something that I would encourage you when you work with veterans is to notice when to give it a try with some direct feedback that you may have for them, and then judge based on their own personal standards how they take that feedback. And then give them direct instructions and clear task assignments. So that's something that veterans do really well. And you may notice this, but one of the things you may find is that veterans, they will do things that you give them as a checklist. And Ken and I were just talking about this when we were preparing for this call. We kind of laughed about it because he's seen this with veterans. You may have a list of things that are meant to help them open up emotionally. Hey, write this down, journal about this. Do this thing, do these tests, do this activity. They may come back and say, I did X, Y, Z. I did all the things on the checklist, but they're still not opening up because they will follow directions, but they may not completely open up about those things. So when you're giving them direct instructions, be assured that you explain to them what the purpose of it is. And then that will help them to open up more with some of these practices you may have, and be real with them if you see that they're skeptical. Next slide, please.
I'll just say one comment, Jared, on this one.
Yeah.
We have the Learn More box over there. And number one, I completely agree with and want to emphasize and amplify what Jared's saying about listen to them tell their story. That was one of the key things I learned when I was an intern, is when a group of Vietnam veterans sat me down and said, listen, college boy, let us tell you what went on when we were in country, right? So the Learn More links there are to two resources where you can learn more about military culture, veteran culture, if you'd like some background, but that doesn't mean that you shouldn't listen to their story. Don't presume that you know all this stuff because you took an online course. But anyway, those are some links if you're interested in learning more. So we'll go on to the next slide. And I can frame this up, Jared, and then ask you to jump in. So we're going to talk a little bit about the diversity of the veteran population. You may not be aware that there's a significant portion of veterans who are female, and that percentage is expected to increase substantially between now and 2040. A significant portion of the veteran population are of ethnic and cultural minorities. So 24% belong to an ethnic minority group, Black or African American, Hispanic, Latino, Asian American. And then additionally, an estimated 1 million plus veterans identify as LGBTQIA plus. So there's also diversity in terms of the branch of service. That's something, Jared kind of spoke to this as a Marine infantryman, that gives them that's different than an Air Force pilot or an Army kind of logistics person, right? They all have different experiences. It's not kind of a unitary thing. And we'll talk a little bit also about kind of the intersection of different identities and how that may turn out. So I think I put on the hat of an anthropologist. As a psychologist who's not a veteran, I really want to be like a participant observer. I really want to understand the culture from the inside out, and that's why I listen to people's stories, right? And the question then becomes, like, what level of rigidity might they have about their diversity or their identity, right? And do they identify as a veteran, as a person of color, or as both of those things? Do they see themselves as a victim? And that's where I'll kind of hand it back to Jared to talk about how that identity as a victim or even as a disabled veteran can actually get in the way of their effective use of psychedelic healing. Jared, do you want to make any comments on that?
Yeah, you said it really well. The military culture is extremely diverse, but we do have a lot of things in common, and that's what kind of makes us almost a cohesive force. But that identity can be different depending on what job they held in the military or what they did while they were in the military, if they deployed or if they didn't, if they had a significant trauma or if they didn't. These identities can be fluctuating, but ultimately, one of the goals of joining the military for the military industrial complex, for instance, is to give this person a new identity. When I got out of the Marine Corps, they told me a phrase: "Once a Marine, always a Marine." So basically, this is your identity forever. Like, you'll never be able to let go of this. It will always be a part of you. And when I first got out of the military, I didn't like that. I didn't want to be associated with that anymore until I started to kind of integrate my own military experience and understand that it is a crucial part of my life. This isn't a lot like coming out of college, for instance, and having a college identity where I went to this school and I supported this team and I have this. There's so much more to it because it comes into a state with deep identity, because your life also depended on that identity at some points. So where that comes into psychedelic work is, and I'm sure most of you know, psychedelics do great with loosening up the identity, of making you ask, who am I really? Who am I without these roles? So when it comes to veterans, that role may be something that they may not want to identify with, but it could be something that they're holding on to, something that we're working in that aspect. So when you're working with the veteran identity, you really want to find out which one do they resonate with the most, which identity are they in, and that can give you a better understanding of where their position is and how you may be able to loosen it and be able to maybe reframe some things to get them into a different perspective of that you're not just that, you're not only this, you are more than that. And that's something that a phrase I like to use with a lot of the infantry veterans is, are you ready to hang up the rifle or take the armor off? Because the hypervigilance that we experience as veterans, for instance, can be like that, where you're constantly carrying around that metaphorical rifle in a sense, just like you were on deployment. And having those identities with PTSD and everything else, when it comes to disability, we can get into that in another slide, but those are also part of the identity. Now they get into a victim mindset and they start making excuses for these things. And an analogy I'll say for that is, it's like a person who lost their leg says, I can't climb that mountain because I lost my leg. And then you can point another person, well, that person's got one leg and they climbed a mountain. So it's about a mindset as opposed to where they're at with their own personal identity. And as we know with identity, it gets really nuanced and can get really convoluted and layered. So that's the quip I have to say about that, Ken.
Yeah, awesome. I like to quote you, Jared, is to say, recognize, understand, and honor the veteran identity, but don't put them in the box that they put themselves in. I think that's a really powerful way to kind of understand the diversity considerations that you should bring, as well as, the critical eye towards some of the identities that they may be carrying into the psychedelic work that is going to get in the way of their successful healing. And just to hit on the practical notes, I hit the first one there. Talked a little bit about being curious. So be an anthropologist, ask a lot of questions, kind of sit with them, join groups, things like that. And then as Jared kind of emphasized, we need to personalize our approach based on the intersection of these different identities, right? As a veteran, as a person of color, as a disabled person, whatever, as an LGBT person, whatever, that intersection of identities is where we need to personalize the type of care that we offer. So with that, I'm going to go into our, we're teed up for our next section here. So Nico, I don't know if you have some suggestions for us or questions from the audience that we can address at this point.
Yeah, absolutely. So just a real quick question, just to get it out of there. This will be recorded. It will be emailed out to everyone registered, and it will be posted on a website and shared more broadly. But first question for you that I'd love you guys to address is, there's some folks here who are excited about becoming or a coach with Heroic Hearts Project or helping you guys out in other ways. How do people get involved if they're excited about the mission?
Well, I can
cover that. Yeah. So we do have a pretty large amount of people who do want to help. And I love that there are veterans in the space that want to help. The first thing that I would say is, if you have not gone on a Heroic Hearts retreat and you are a veteran, I would suggest signing up for a retreat itself so you can learn how our program works from inside out and you can go through the experience yourself. Second, you can contact us on our website through the Contact Me part of it, where you can get a hold of Heroic Hearts Project, and then you can find out more information about how to become a coach at this or a facilitator with us, especially as we grow. I do want to mention that we are still a very small nonprofit, so we try to get as many people as we can to help and assist along this way. So there is a pretty big wait list to become a coach, but we are working on trying to expand that, especially more as we grow, and hopefully as the word gets out and more donations come in to support our mission.
Amazing. Okay, let's keep it going. And for those of you in the audience, keep using those questions to answer and to vote up the ones that you want to hear answered live. And we'll get back to some live questions after the next section.
Great, thanks, Nico. So moving forward, we're going to start talking about PTSD in veterans, and I'm going to start that section with talking a little bit about diagnosis, assessment, and current therapies. So moving forward here. So let's talk about DSM criteria. I know that there is probably a variety of opinions out there in amongst our audience about diagnosis, and what is it good for, and maybe it's harmful and gets in the way. I'm going to kind of make a case for why we need to understand DSM criteria. Just to review them real quickly, what are the A through E up there are the criteria for DSM diagnosis of PTSD. The first one is exposure to a traumatic event, right? What's interesting is that they went to DSM-5 from DSM-4, witnessing an event rather than experiencing it, but not being the victim of the event can actually cause PTSD. The presence of intrusive symptoms like recurrent intrusive distressing memories of the event, nightmares, flashbacks are kind of a hallmark feature of PTSD in its diagnosis. You avoid a stimuli associated with the traumatic event. Involves thoughts, feelings, external reminders, just kind of shut that down. There's negative cognitions and mood, and that's really focuses on kind of a negative, persistent belief about oneself, the others, the world, and it's really kind of aligned with a way of thinking that a lot of your experience of the world comes through your kind of cognitive processing of it, or your thinking about it. So we're going to try to change that in some of these treatments. And then finally, there's arousal and reactivity. So these are things that most of us are familiar with. There are things like irritability, angry outbursts, recklessness, hypervigilance is really the kind of the symptom within that cluster, right? And then you have to have it for a period of time, last more than a month, and it has to cause clinically significant distress or impairment in social occupational functioning, just like most disorders in the DSM. So let's kind of talk about the elephant in the room, which is like, do we even want to diagnose people, and what are the advantages and disadvantages of doing that? Well, I would argue that general awareness of the diagnosis is important. In part, even if you don't believe that it's a disorder and you don't want to treat people as such, appreciate that the diagnosis has some heuristic value. So what that means is really, it's a method or strategy of making a decision, even if it's not guaranteed to be the best fit for or most accurate description of the situation. It's a way to kind of quickly find a good solution, to use some rules of thumb or approximations rather than following some sort of precise algorithm. But so appreciate that it can have diagnostic value. Understand that one of the advantages of speaking the language of the mental health establishment around PTSD diagnosis is the case that there may well be situations in which the individual is presenting with symptoms and a potential PTSD, substance use, psychotic disorder, what have you, where you don't feel qualified, or it's not within your scope of practice as a licensed facilitator or an underground practitioner to deal with somebody who has this level of symptoms and dysfunction. And in that case, you may want to make a referral. And in that case, it's helpful to have that referral be informed by the diagnosis that the person may meet criteria for. So I know, Jared, you want to talk a little bit about kind of about over-indexing on PTSD and some of the ways which it can get in the way of the work that we do with our veteran clients.
Yeah. Besides the ones that strictly identify with their diagnosis or over-identify with their diagnosis, which we talked about a little bit ago, There's also those veterans who don't identify with these diagnoses and they are completely against it, saying like, yeah, the doctor said I have this, but I don't. And so it's really important that for me, when it comes to learning about the DSM-5 and learning about these kinds of diagnosis, a lot of the veterans know about the DSM-5 because they've been navigating the VA healthcare system to try to get their benefits in the first place. So they learn a lot about what these symptoms or what they can look like, and then they maybe overdiagnose themselves as well. So again, I like to just mention that, like, and I'll probably say this a few times throughout this, is that we're talking about person, then veteran, then diagnosis, then other identities and everything else. So it's person first when it comes to those things all the time. But for myself, working in this space, especially with psychedelics, there's a lot of people who are interested in learning about these things. So having a basic understanding of what these terms are, what they mean, and sometimes you even have veterans that will diagnose themselves without actually being diagnosed, and they may not have what they think they have based on the DSM-5, and that can actually be helpful for them to know that they're not, they don't have PTSD, or they don't have bipolar, or they don't have these other symptoms that they may find in there. But we are very rooted in that identity in America, especially in American culture. We like to really lean into our diagnosis: ADHD, PTSD, bipolar disorder, OCD. All kinds of things are thrown around on the street, and people really lean into them as that's who I am, as opposed to that's something that I manage, or something that I'm working with, or something that I have in my life. So just to remember that, to loosening that identity with the veteran and with our own selves. Because I mean, if you can't work on that in your own self, then it's going to project onto your personal clients or your veteran that you're working with.
Thanks, Jared. That's really helpful. I'm going to turn it over to you again for the next slide, and we'll dig a little bit into complex PTSD and how we need to be aware of and manage and to navigate that issue with veterans in psychedelic treatment.
So complex PTSD, if I'm not mistaken, Ken, is not in the DSM-5, but it's
correct. That's correct.
It's recognized within the psychiatric community, but it's not in the DSM-5. So we all may know what PTSD is or may look like, and it can be big T trauma happens. And what that means is like a car accident, an explosion, a violent event, a traumatic emotional event, all kinds of things. Big T trauma happens, and in the nervous system, that is now in a stuck place, which looks like you can have flashbacks, nightmares, but your nervous system is kind of stuck in that fight or flight state, especially when triggers are coming up when it comes to smells, taste, touch, any kind of sensual interaction that happens, or even just a thought can trigger some of these symptoms with PTSD. Complex PTSD is something on a different level. It can be a big T trauma, multiple big T traumas. But the way I like to look at it as an analogy is PTSD comes from like you're locked in a room and the whole room is flooded with water up to the ceiling, and it's in an instant, and you are terrified you're going to die, and all of that happens. And then that's PTSD. Complex PTSD is you're sitting in a room for the next week, and that room is slowly filling with water, like it's raining and it's slowly filling with water. So at first you may not be thinking it's a big deal. You may be able to move through it, but as it starts to fill, that's when it starts to get very traumatic. So that's how I try to see when it comes to complex PTSD is it's multiple little complex issues that have happened throughout a person's life or throughout a certain significant period of time that leads to the same symptoms that people may be going through with PTSD. And even more nuanced, they may not know what their triggers are because they may have these small little things that come up that start to trigger these emotions for them or these symptoms that they may be occurring.
Thank you, Jared. It's super helpful. Let's move along here, and I'll take the next slide, which is about PTSD assessment. And I just there's a bridge here between what I was talking about with diagnoses and what I'm talking about here with assessment. The referral for formal assessment and diagnosis, may be necessary if you feel like the person's the severity of their symptoms, or that their functional impairment is getting in the way of their ability to do the psychedelic medicine work with you. You may need to refer. And in this case, either the clinician you're referring to or you yourself can come up with, perform an assessment that will help you determine whether they meet the criteria for that diagnosis. I'm going to just walk you through two kind of gold standard measures that are used commonly in clinical trials of psychedelic-assisted therapy, MDMA, psilocybin, etc. The first one is the CAPS-5, and here we're basically getting to diagnosis. It's really labor intensive. It's like 45 to 60 minutes of interaction with the client. And it happens with a trained interviewer who performs the interview in a structured fashion, right? So it's not just kind of free floating, tell me everything. And it's also not a checklist. It's kind of it provides guardrails for the clinician about how they can talk about the symptoms that their client's experiencing. There's 20 items in there. They correspond to the 20 diagnostic criteria and are grouped according to symptom clusters that I talked you through before: intrusion, avoidance, cognition, and arousal and reactivity, right? So the PTSD checklist I want to share with you, because that's a much more useful, I think, tool for us as providers to be able to incorporate into our practice. So the PCL is a self-report measure, right? Now we just got 20 questions that we're going through and ticking off boxes, right? But it can be really helpful to collect this type of information about the severity of the symptoms that the client is experiencing, because we can do things like monitor symptom change before and after treatment. That's what our colleagues in research do, is measure the level of severity of symptoms that somebody's experiencing before they go on retreat, during preparation, and then immediately after retreat, and then subsequent to that for a longer term follow-up. It's a great way to screen patients for PTSD. So if you're concerned that somebody may have this disorder, or they may meet criteria for it, or however we want to frame that, this is a great way of asking them 20 questions and figuring out, ballpark wise, like I was talking about heuristics, what's a rule of thumb here? Is this somebody who has a very high score? Are they in the middle? Are they low? That can be helpful in terms of determining whether you're equipped to handle that person in psychedelic-assisted therapy, or whether you want to make a referral. And it can also help you make a provisional diagnosis. Again, if you're a licensed or credentialed mental health counselor, you know all about this stuff, and apply what you know in these cases to help understand the veteran better and figure out how you can optimize their trajectory through the psychedelic healing process by identifying those who may have meet criteria for this disorder. That's all I have to say here. Anything you want to add, Jared?
Yeah, just from the veteran perspective, especially when you're working with them, I want this is really good information to know. I know it's just like, how much time does this take for a veteran to get diagnosed by the VA to get their benefits, to say that they have PTSD? There is all of this and more that they have to go through. So a lot of vets that actually are diagnosed PTSD and are collecting benefits for it, they had to earn that diagnosis for them. They had to actually prove it over and over and over and over again, sometimes for a course of years, before the VA finally recognized that they had PTSD. So knowing about these steps is kind of helpful, just to understand that that just to even have this diagnosis from the VA takes a long time for some veterans, and can build some, which we can get into later, a little bit of mistrust when it comes to when they tell people what's going on, that nobody believes them, or they have to prove it, as opposed to hearing them and then just understanding what they're saying. And that's all I got, Ken.
Thank you, Jared. We'll move on to a kind of a related topic, which is screening. So for the Heroic Hearts program, here we go. There are a variety of steps that we go through to make sure that somebody is going to be safe and be able to benefit from a retreat and all the preparation and integration that we offer around that. So our steps are: there's an initial application where people request to enroll into a specific program, and then they undergo an intake call for about 30 minutes usually with a coach or a facilitator from the program, to just kind of get a general sense of, like, is this somebody who might be a good fit? There's actually a safety screening that follows from that's conducted by a licensed mental health provider, and they go through issues like, the following criteria here is like, are they making a commitment? Are they safe from suicidal and homicidal tendencies? That's kind of within the realm of kind of the licensed practitioners. And you can see on the right side, we raise red flags when we encounter the following situations that a veteran may be experiencing. If they're unhoused or they're having an unstable living situation, that can make it really hard, particularly around the integration piece. If they're having suicidal thoughts, we want to assess that carefully to see whether that's suicidal ideation, is there intent, is there access to lethal means. We're going to talk a little bit about suicidal behavior and how you can address that a little further down the road here. Have they used psychedelics recently? Are they kind of a big fan, already kind of familiar with the experience? Addiction tendencies is kind of mislabeled in this slide. We're really looking for somebody who has an active addictive behavior that kind of includes substance use disorder, but as well as alcohol use disorder and other behavioral addictions. So we're assessing whether somebody, the level of that experience or that substance consumption, for example, is really going to get in their way of their ability to benefit from the program. And we'll get into a little bit later about the specifics around addiction and how we screen out. Where do we draw the line, basically? Some other flags that come up are people are on many medications. That's often the case with veterans. In my experience, there can be up to 20 medications. It's quite insane how much they're trying to manage, and that can tapering off the medications is actually an important element of preparing for the treatment, and that can be really hard if you're on opiates, if you're on benzodiazepines, if you're even SSRIs have a really significant discontinuation symptom. So they have withdrawal, and people don't talk much about that. If they have mental health concerns about, that they meet criteria for PTSD, they meet criteria for a psychotic disorder, that's going to be somebody who's not a good fit for this, or I would argue any other psychedelic-assisted therapy program. Then if they have physical health concerns, particularly cardiovascular issues, that can raise a flag that we don't want to put somebody at risk in terms of their medical condition by going through the medicine work. And then finally, abusive relationships. If they're in an abusive relationship, that can really set the stage for negative or unproductive kind of psychedelic or medicine experience. And so we have developed a standardized screening process with timelines. I encourage you to apply similar screening criteria to some of the veterans that you work with to make sure that they're safe to do the work that they need to do. Flag people for concerns, as I said, and I'll just let Jared speak to this because I think it's a core value of the Heroic Hearts program is that it's okay to tell people you're not ready yet, that this isn't the time for you. And I know, Jared, can you talk a little bit about the gates in the program and how we help to make sure that the people who go on retreat are the people who are going to benefit the most from that?
So the most important aspect of what our program does is we want to make sure that they are safe, whether that be emotionally or physically, in that sense. And we always have integration in mind, not just working with the psychedelic as well. How are they going to integrate? How are they actually going to be there? So, if they're unhoused at this moment, for instance, and they are sleeping in their truck under a bridge, I can only imagine how tough that would be to break apart my reality and then come back to my truck under the bridge and try to integrate how to be a better person into my life when I don't even have a structure or something that I'm living under where I feel safe. And we want to make sure that that they're going to be safe when it comes to interactions with any medicine that they're working with. So some medications are just an absolute no-go, or if they are having active suicidal thoughts or ideation with plans or anything else, we don't want to make sure that their reality is stretched so much that they come home and they say, well, nothing matters, and it leads to something really terrible happening. So all these things are geared towards veteran safety when they're working through our program, not just at the retreat, but through their integration process and what's best for them. And like you said, Ken, we find that it's veterans get turned down a lot by medical establishment, by all kinds of things when they are signing up for this. So we think that it's ethically sound that we need to make sure that even if we cannot send them to a retreat with us, we will find them something that does work for them, whether that be non-psychedelic or psychedelic. So depending on what's going on, we may suggest them to other clinics that work directly with their kind of diagnosis or with that medication that they're on, or we may start giving them a list of different nonprofits that they can work with that will send them on other things to help them, maybe even help them find therapists or something along those lines to give them some support. We don't just leave it as sorry, not you this time and go. We send them a list of resources and continue communicating with that veteran as long as needed for that way they know they're protected and held through our process.
Thanks, Jared. Yeah, I think that emphasis on safety is a critical one to remember, and the issues around suicidality are important to track. Again, I mentioned we'll get to that a little bit later, but yeah, safety is paramount, and so think about adopting a similar screening process, maybe not as formal as ours, but make sure that the people who you select to work with are going to be appropriate and held safe. Moving forward, let's talk a little bit about trauma-focused therapies. I kind of frame this as the same way I talk about diagnosis and assessment. It's like you may not do trauma-focused therapies, and that's okay. Trauma-focused therapies, just to describe what they are, these are evidence-based practices, primarily based on cognitive behavioral therapy, that are designed to help those with PTSD reduce their symptoms, increase their quality of life and well-being. And they've done large clinical trials on each of these trauma-focused therapies that I'm going to run you through quickly here to show that they work. So they're pretty powerful therapies. Cognitive processing therapy, just to run you through here, it's a form of CBT, and it really focuses on changing unhelpful thoughts related to the trauma that they have, right? So they may have, we'll get into this later as well, but guilt, shame, blame, all these cognitions around a traumatic event can really get in the way. So CBT works on trying to get those cognitions to be more reasonable and realistic and charitable towards the person. Prolonged exposure therapy, you may have heard of. It's like repeated, detailed imagining or describing the trauma, but the idea that if you're afraid of something and you go towards it, you're going to be able to overcome that fear, right? And there's some really compelling data to show that this type of prolonged exposure work, particularly when you condense it into like a 2-week period and give them all sorts of other wraparound services, you can have some really powerfully good outcomes. EMDR, maybe many of you have heard about it. It involves recalling the distressing memories while you're doing some sort of bilateral stimulation, eye movements, taps, sounds, right? And the idea is that behind EMDR is that you're going to process and integrate traumatic memories more adaptively. I would argue that there's an exposure element to EMDR. You're doing this bilateral stimulation, but you're also going towards that which you have been traumatized by or afraid of. So that's an important role. Trauma-focused therapy, TFCBT, is primarily used with kids. It involves psychoeducation, relaxation, coping skills, and helping people describe their trauma narrative, right? And then wrapping it up here, written exposure therapy, or WET, is an interesting new development where people basically just write about their experience at length. And it's been found in clinical trials to be a really effective strategy for reducing PTSD symptoms. And this lines up really well with the way that Jared and their team use structured materials to help people journal, to help people reflect on their experience, and to help them kind of make sense of what they're doing. So that's more, we have some data from the scientific study showing that this type of writing or journaling exercise is really powerfully effective, right? And then finally, I'll just throw in narrative therapy, or STARE, is primarily used for complex PTSD, and it starts out with kind of some emotional regulation skills, helping people to kind of moderate to experience their feelings, but also kind of titrate their exposure to them. And then they do some narrative work, so telling their story. And that's what I'd leave you with as we kind of run through all this. It is all about telling your story. It's about telling your story about the thoughts that you have. It's about telling your story about the things that you've been avoiding, and developing a more better narrative that more accurately describes your role in all this, and is, again, more charitable and kind of a kinder frame for you. Let me kind of point out the other side of all this, which is that there's a huge problem with real world effectiveness and dropout. So my rule of thumb is like 50% of the people in these trauma focused therapies drop out, right? They're not fun. Prolonged exposure is a not fun experience. And if you're avoidant, as you have PTSD, that's going to be something else that you're going to deal with. And then of the people who stay in, 50% of the people get better, right? So that's there's a significant portion of people who get help, but there's also a significant portion of people who do not. Some researchers are evaluating whether they combine psychedelic-assisted therapy with evidence-based psychotherapy, such as the ones we're talking about. We don't really have an opinion on that, whether you use an interdirected therapy like the MAPS therapy, or you use a more structured CBT therapy. Those can both be helpful. And I think that's where I'd like to leave you, is like, you have a toolbox as a facilitator or a therapist, and these therapies have some tools inside them that could be helpful to you. So people may not be interested in following a whole treatment protocol, and that's totally fine. I think as clinicians, we're all kind of, like, say, eclectic integrationists. We're going to pull from our toolbox, and we're going to assemble a kind of an experience for that client that's informed by everything we know. And we're going to pick a tool that is going to be most helpful to their personal situation, right? So learn about the psychotherapy so you can see if there's anything you want to bring with you into your work. I think a lot of folks in the field kind of throw all this stuff out but I think you're throwing the baby out with the bathwater, because there is some value that you can bring from these therapies into the work that you do with your psychedelic medicine clients. Jared, you want to add anything to that, the toolbox or anything like that?
Just to tee it up with, we don't, as facilitators and as coaches, for instance, we don't have a board that regulates a license that says we have to continue our education. But I think what makes us really a really malleable field in that sense is by learning about these and then taking what works for us, especially in this space, and other things. And I'll just kind of do an honorary mention for internal family systems is something that I found works as really well as in the psychedelic space as well. And you don't have to be an expert on these things, but just to reiterate what Ken said, take what works, put it in your toolbox. And if you really like it, maybe you want to go become an expert in it and use it that way. But we are pretty agnostic when it comes to which therapy works best with what, because I think it really depends on the person and where they're at with their own personal healing.
Thanks, Jared. Yeah, that's very true. Like, we don't know how to match people up with these therapies, right? But we do know that they have some elements that can be helpful. So let's disaggregate it. Let's open the hood and poke around under there and see if there's anything we can use, right? So let's see. So that's all we had on trauma-focused therapies. I'm going to segue into military sexual trauma here, which is unfortunately an issue that affects many of the service members and veterans that we work with. I'm just going to define it, and I'm going to let Jared talk about how it's experienced, why it's so damaging and challenging. Military sexual trauma, can be even more damaging than sexual trauma experienced outside of the military, and we'll explain why. So MST, just so you understand, is any sexual activity that someone's involved in that's against their will. So it's basically sexual harassment or sexual assault that happens in the context of military service, right? And just to give you some examples, and I won't run through all these because we're probably all well aware of what sexual trauma is, and it's all about consent, right? If people are engaging in a sexual manner with the client that is unwelcome and they do consent to, that's abuse. And that needs to be addressed pretty seriously. This presents oftentimes in the context of psychological or psychotherapy work with veterans. I think the one point I'd leave you here, and that was what I was trying to emphasize in this graphic that we got from the VA, is like, there are all people of all sexual identities, orientation, ages, race, ethnic group, period of service, physical sizes, all these things. All these people can experience military sexual trauma. And I just leave you with, there's a significant portion of male veterans who have experienced military sexual trauma. So don't just think about it as a female issue. It's definitely something that male veterans have experienced as well. So let me turn it over to Jared to talk about some of the reasons why military sexual trauma can be so damaging. Let me change the slide on this one. Here we go.
Thanks, Ken. Yeah, a really hard topic to talk about. but it's very real, and it's also not talked about enough in the zeitgeist of our community in military culture and outside in regular civilian culture. Military sexual trauma not only is traumatic from the event itself, but it's traumatic to the person because it compounds on a lot of different ways. Say it's from a superior officer, say it's from a person that you live with, you work with, say it was on deployment, say it was in all these different kind of situations. By speaking up about it as the victim of one of these things, or the survivor, as I like to put it, the survivor of military sexual trauma, you're upsetting the status quo. You are putting that mission first mindset in jeopardy, because whole units have been under investigation because of things like this. They shut down things that go on. They remove the person from their unit, which is their friends, their family, their protection, their everything from these kinds of things. They remove them out of there. A lot of times, even commands will try to sweep it under the rug because that mission first mindset that we have a deployment coming up, we have this, we don't want to deal with this right now. We have something else to deal with, and they will try to. And there is victim shaming. There's all kinds of a whole giant cake of trauma that comes down on layers on top of the person who goes through this. So a lot of this is not reported. A lot of this is not even talked about till the person is out of the military. And so when it happens to someone that's in the military, it completely destroys a layer of trust that they had with the people around them. And as you may have heard on many different war movies or books or anything else, they say it's not about the mission or the thing, it's about the person next to you. What if that person next to you has now become the predator? What if that person next to you is someone you deeply can't trust, and now you're going to go on deployment with them, or you're doing a job that has to do with saving people's lives or saving your own life? How does that affect you as a person? How does that affect you with that sex of that person in your life? So whether it's male, female, or different. So as practitioners, when we're working with this, we're especially working with this area, this can be so deep in complex PTSD that we have to be very mindful of how we work with them. So for instance, with Heroic Hearts Project, we offer different retreats. So we have all women's retreats, all male retreats. We have retreats for veterans that kind of identify in these certain subset groups to make sure that they feel safe, because I may have all the best intentions in the world, but for a veteran, I may actually look like that person that hurt them. And so there's already layers of mistrust when it comes to me holding that space. So as a practitioner, you might want to find out if that person has gone through something like that. Do they need to have extra support? Do they need to have those kinds of, do they need to have a female present or a male present or anything else to help them feel safe? Understanding those layers of mistrust when it comes to establishment as well, because a lot of them have been harmed by the establishment that they thought was supposed to protect them, because it actually was out to get them by victim shaming them and denying their results of what actually happened. So this is something that is worse than just a corporate job, because in the military, you can't quit. You can't quit at all. You sign up, and if you decide to quit, you actually lose your benefits, or even worse, could go to jail because you decide to not go. They can call you deserter or anything else along those lines. So it's one of those things that you sign a contract at 18, but even if you feel different at 20, it doesn't matter. You are in the military until your service is up. So a lot of these cases are so complex when it comes to the trauma that occurs to the person that it's much deeper than just the assault itself. And I think I hammered in that pretty well, Ken.
Yeah, you sure did. You sure did. Yeah, I think the last point I would just make is just to emphasize is MST and identity, and it's much like we were talking about the the intersection of various aspects of diversity. Is somebody's identity as an MST victim could potentially get in the way of their psychedelic healing, because the story that they're telling themselves is, I let this happen, I allowed this to happen, and that becomes who they are as opposed to something that they experienced. So just to kind of point that out as well. Let's go forward here, and next slide. I'm going to talk a little bit about veterans and suicide, talk about a serious topic. Here's some really disturbing facts for you. Since 2001, more veterans have died from suicide than all the service members who died in combat during that same period, those 20 years. Veterans are more than twice as likely to die of suicide as the general population. And 17 veterans a day will take their lives. So 17 veterans will take their lives today, which is just unacceptable and appalling, and something that we as a society need to work on. There are some resources that the VA has put together. You can see I put the Veterans Crisis Line as a giant picture here on the right-hand side. That's an awesome resource, and it's staffed by people who understand the veteran experience and some of the challenges that the veterans face. Just to give you some more facts about veterans and suicide, people who have been in combat and got trauma related to being wounded more than once, or they're in the hospital for a wound, are at the highest suicide risk. So that might be something that you ask about as you're doing your screening conversation. It's higher in people with PTSD. That's one of the reasons why we hope and expect that MDMA treatment, for example, for PTSD is going to reduce veteran suicide. And that's one of the reasons why Healing Breakthrough within our organization is advocating so strongly for that in the VA. People who have certain styles of coping, like not expressing their feelings, or bottled up, can really have a higher suicide risk. And that research suggests that for veterans with PTSD, the strongest link is to both suicide attempts and thinking about suicide is guilt related to combat. We're going to get into survivor guilt. I think we touched a little bit on it as we talked about military sexual trauma there. So the issue that you may be thinking about next is like, well, what do I do about this? Well, one is you can screen on the front end to see if somebody has, not just suicidal ideation, but a plan and access to lethal means, all those things. What I want to point out here, and you can see a link at the bottom of the screen I would encourage you to check out, is VA encourages clinicians to do safety planning with veterans who are at elevated risk of suicide. And the elements of the safety plan, as you can see on the slide, are actually, let me advance. I keep advancing the wrong slide. Here we go. This is a safety planning app, and you can see the link on the lower right-hand side. The safety planning process involves 5 steps. First, we're going to identify early indicators of a crisis. So how do we know when somebody is likely headed in that direction? We help to inventory their internal coping strategies, like what do they know, what can they do? Engaging social contacts. So social connection is a really powerful protective factor against suicide, well, against mental health issues in general. So it's one of the reasons why I think the Heroic Hearts Project is so effective is, as Jared mentioned in the beginning, we do everything in a group and we support alumni in supporting one another. Reaching out to family and friends, which is a very difficult thing for veterans to do. We're going to get into that in a moment. And then contacting professionals or agencies. So I think that needs to be on the table, is that you may, again, need to refer out if you feel like the level of suicidal ideation or thoughts or intent or plan that the person's expressing is something that's outside of your scope of practice. And the last point I'll make and ask Jared to amplify is really be careful about using safety language with veterans. They may have a different perspective on danger and safety. Somebody who's been deployed and has been in the combat environment is going to think about safety very differently than somebody who has not had that experience, right? So they may see danger where others don't. They may be more vigilant for danger than civilian folks might be. But Jared, what do you want to add to that around safety and around safety language?
Yeah, risk assessment is something that we were hammered into us in the military. I mean, like we had to fill out a risk assessment form just to go out on the weekends. So it was one of those things that we got really good at being able to recognize some of the small things and little things, and then how to mitigate these risks. So when you're working with veterans, I would suggest that you give them the safety plan about like what happens if and what we're going to do if. And then, don't try to oversell it, but if there's, but let them ask questions. Do you have any other concerns and how can I answer those for you? So that way, if they're saying, well, what happens if a fire happens? You can say, well, we have a fire extinguisher. I have my cell phone. I can call. I can do these things. And you make sure that they know that if they feel confident that you feel confident in the safety plan, then everything will go smoothly. But if you don't give any safety plan at all, that can really affect the veteran, not only in their session, but interacting with you as a person. So just understanding that they do have a higher sense of what the risk assessment is around them, and that they're always paying attention and things, because a lot of stuff that we've learned with heroic hearts is some of our safety briefs were not detailed enough, because they had all these questions when they got back from the retreat. What happens if this happens? What happens if this happens? What happens if this happens? So we started detailing our safety briefings much more to answer these questions that we thought were not needed to be answered, because we were like, well, we know what to do. We know what we're doing. But these veterans are really keen to that. And when it comes to altered states of consciousness, veterans are a bit nervous, and they don't know what's going to happen or who's going to be in charge or how safe they are. So making sure that you have a safety plan is really important. And making sure you have not just a safety plan, but what happens if the safety thing goes off the rails, or what happens, and then allow them to ask questions, so that way you can get to that, make them feel more comfortable with getting into working with you.
Thank you, Jared. I'm going to move on here to traumatic brain injury. This is kind of the signal injury of, the one of the signature injuries of the global war on terror, of traumatic brain injuries, and part due to improvised explosive devices, but they can be caused by all sorts of things. So it's when you get a blow to the head and it causes injury or disruption of your brain function. And it can be in combat, it could be in a fall, a motor vehicle crash, sports, boxing, football, interpersonal violence, right? But so something to appreciate is that many of the contexts in which somebody experiences a TBI can be psychologically traumatic, right? If you're in combat and you have a blow to the head as a result of an IED or something, there may well be some trauma that accompanies that, of course, right? So it's not uncommon for somebody to have both TBI and PTSD. And the field's still learning a lot about that. The symptoms kind of overlap. It's difficult to disentangle them, but just be aware that traumatic brain injury is something that that's pretty prevalent, particularly in the more recent generation of veterans. And moving forward here, I think people with TBIs or multiple TBIs in particular are more likely to develop PTSD than people without that history. So, and in clients with co-occurring TBI and PTSD, you can help people to appreciate that if you can work on your PTSD symptoms, your traumatic brain injury symptoms might improve as well. So to give you some kind of practical tips about this, there is a potential red flag here, because TBI can cause impairment in reality testing. That's much like a psychotic disorder, right? Where you're not operating in the world that the rest of us are operating. So consider that as maybe a TBI could be a red flag. You got to do some more assessment and investigation into whether that's really the case. An important point here is that many people with TBI experience kind of cognitive deficits or cognitive impairment in executive functioning as a result of their injury, right? So I love this term, cognitive prostheses, right? It's kind of like a prosthetic leg, but it's for your brain. And it's going to help people, keep a notebook, keep a journal, use a smartphone app for reminders, keep a calendar, track your tasks. And I think the workbooks that we've put together and have made available are one way to help people structure their experience and give them the support that they need so they can really benefit from the treatment. And then, also think about working with a mental health professional. Here's another case where, if somebody has a serious TBI as well as severe PTSD, that may be somebody you either want to refer out or at least kind of get consultation from somebody who has kind of the subject matter expertise in the space. That's it for me. Jared, anything else about TBI?
No, you covered it well. I just, as a practitioner, I'll just tell you, be patient, because sometimes people need things repeated a few times when they have executive function issues or anything else. But I do want to reiterate that serious TBIs can be a red flag, as I say, is that they may not remember metaphorically their zip code completely. So depending on where they're at in their state of reality, we also don't want to over warp that reality into a different state that could lead them into something that is dangerous for them or the people around them.
Thank you, sir. We'll move forward here and talk about PTSD and substance use. This is so amongst veterans with PTSD, up to 60-80% meet criteria for a substance use disorder, right? Alcohol, as Jared has educated me, and is encouraged in the military, right? It's encouraged as a way of dealing with combat stress. It's encouraged as a way of celebrating success. It's basically the only drug that's endorsed by the military that you can use to manage your mood or reactivity or what have you, right? So 1 in 5 veterans with PTSD also have an alcohol use disorder that may have well started in the military, right? And combat exposure increases both the likelihood of PTSD and substance use disorder or subsequent substance misuse. So I'm just going to go around this wheel here super quick just to tell you some of the reasons why PTSD and substance use kind of intersect. One is that substance use is used as self-medication. So I'm not going to go into that because I'm sure it makes sense to y'all. There are some genetic risk factors that both PTSD and substance use disorder share. So there's kind of a genetic or biological kind of predisposition that these two things going together. People may have personality or behavioral traits that can predispose them towards having PTSD and substance use. Early life stress, ACEs, right? Average childhood experiences can drive the relationship between PTSD and substance use. And then there's some overlapping effects of the drugs and the trauma on hormones. So that's another kind of physiological, kind of hardwired response to trauma that drives kind of the use of substances as a result. And then, substance use is a risk factor for trauma exposure. Think about it, right? If you're disinhibited, you may get into situations that are physically risky. You're riding your motorcycle too fast. You're putting yourself in situations where you may be exposed to sexual assault or sexual trauma. So that's kind of just going around the wheel there. Just just to kind of close this out. I've done a fair amount of research on PTSD and substance use, and in many of these studies, if they're studying PTSD, they rule out people with substance use disorder. And my question is always, who's left? I mean, if so many people have both of these issues, that we need to pay attention to the overlap between the two. So, Jared, anything on the overall relationship? I'm going to toss it to you with the next slide.
No, I think you covered it well. I'm ready to hit the harm reduction side of this.
Here we go. Take it away.
So, just for context, I just want everyone to know that Heroic Hearts Project is not an addiction treatment program. There are many types of psychedelic clinics or places that are addiction focused, i.e. ibogaine for opiates, for one of these reasons, and even psilocybin to help with addiction. And what I mean by that, we're not an addiction focused or addiction treatment program, is we want to look at to make sure that are they able to get prepared for the psychedelic by reducing or completely being abstinent from their drug or substance of choice, or behavior of choice, that before they go on to a retreat for their preparation side of things. This can look like we just don't want them to be detoxing on retreat because we don't have the proper staff to be able to house that and to be able to keep them safe or the people around them. We don't want them to be disconnected from any kind of medical services just in case they may need it during a detox or anything else like that. So we make sure that that period of abstinence is at least 90 days or otherwise. And when we say 90 days, that also doesn't mean that, like, if a veteran is working with us and they've been sober for 90 days from alcohol and they have like a beer and they're talking with us and they're feeling really guilty about it with their coach, that doesn't disqualify them. That's part of the work. As long as they can have that they can put a stop to those addictive processes for a long enough period of time where they'll be safe to work with that medicine. And some medicines have contraindications. So we want to make sure that that is also a part of it. So having them be honest about where they're at with their addictions, we want to make sure that they're safe to take certain medicines or certain substances along these lines. And I'm sure all of you know this already. We're still learning a lot about what medications are contraindicated with psychedelics. And I know you as practitioners don't want to be the one in your office that has an incident happen that harms one of your patients or clients or veterans that are in there, because you didn't know that this medication or this substance that they were on was contraindicated with this. So one of the steps that we take with Heroic Hearts Project is we try to make sure everyone's their body is as clean as possible from different medications or substances along that way. Abstinence here is not the goal. it's just one of those things to get them aware of how strong that pull is for them and how it affects their life, and usually getting a little bit of space. So I like to say that a lot of Americans, a lot of us, and sometimes even me included, addicted to coffee. You may not know how addicted you are to something until you say, hey, can you stop that for a week? Can you stop that for 3 weeks? And then that really kind of brings up what's going on. And then we can help that into the preparation phase with doing that kind of stuff. Ken, do you have anything else to add?
Yeah, I would just mention that there are programs that are specifically focused on psychedelic healing for people with substance use disorder, and that's not us, but there are programs for somebody who is in active opiate addiction to engage with ibogaine treatment, and there's some really good results from that. So just because we don't offer it doesn't mean that it's not out there. Cool. Thanks, Jared. We're going to go to our next section and invite Nico to share some of the questions that you guys may have brought up.
Thanks, Ken and Jared. That was a beefy section. We have some great questions in here, and the top question that's been voted up is around. It's from Trudy. I'll just read it. What have you found to be some of the major differences between working with psychedelics and older veteran vets versus those more recently deployed in Afghanistan and Iraq?
That's a wonderful question. So in that space, you may be surprised to hear, or maybe not, that a lot of older veterans don't sign up for our program. But the ones that do sign up for our program, we do find that there are some differences. This comes back into the line with complex PTSD, and when I'm talking about this, I'm mostly talking about with Vietnam veterans, because not only do they have the trauma from Vietnam, but they have the trauma of the next 30 years of their life, from what the culture was like, how they were treated, what they went through their experience, all that kind of stuff. So we really work with these individuals on a very close basis, sometimes giving them extra coaching if needed. While they're on the retreat, I found that some of them are more reclusive, and they don't really want to connect as much with the younger veterans, but they do find it very comforting to be around another group of veterans who just understands to get it. Also, older individuals, they have a lot more to unpack in their life in general, outside of military standards. So working with clients that are in their 70s or in their 60s or in their 80s, they have a lot more. Best way to put it is rooted identities based on their life experience. So if the goal or the hope for them is to loosen some of these identities to come into a new frame of understanding or to a new story for themselves, it takes a little bit more work to try to get them out of those nuances or those really rigid belief systems that they may have about themselves or about those kinds of things. But other than those types of things, I find that working with older veterans has been really easy, and they really enjoy being in our program. Especially the last one we had in Oregon, we had a Vietnam veteran come through, and he worked with psilocybin, and he told me it completely changed his life. Actually, he texted me today and told me how grateful he was for the time that he spent out there with us and how it's affecting his family and his friends and all of those things in a different manner. So that's the short, quick, down and dirty answer for that.
Beautiful. Thank you. Well,
I think I can answer that other long one that I see in there as well. Actually, great. Pretty quickly. So it's about the Section 27 of the NDAA. The Secretary of Defense may approve any active duty member for armed forces. So the key word there is may approve. So Heroic Hearts Project is tracking this, and we're following it very closely. We have people who are working on writing grants. So for grant approval, some of these things that are coming out when it comes to funding for HHP may not be funding that goes towards nonprofits. It may just be going towards military or to other establishments or like that. So we see this as a win in the fact that veterans' voices are being heard, that psychedelics are helping and assisting them, and that it's getting into the federal zeitgeist, and that it's becoming bigger in that area. Depending on where the funding comes from and if it aligns with our values and everything else, we'd be happy to take on some funding from this exact thing moving through. But we have to do our due diligence and make sure that it's aligned with us and moving forward from there. So hopefully this all counts for a win, at least that the veteran voice is being heard, that psychedelics are helping.
Yeah, I would just add to that, Jared, that the one thing to note is that they're funding research, right? So it's super encouraging that this is on their radar and that they're moving towards supporting veterans getting access to this psychotherapy, but to this psychedelic assisted therapy. But it's going to take some time, and so they're giving the money to the clinical trial. Clinical trials take a really long time; they take 3 to 4 years, right? So I think it's and the VA is pursuing similar approach where they've allocated like $2 million or something to do research studies on this stuff. That's great. We're super supportive of that. That's going to answer a lot of the questions that we've been raising that we don't have answers to. And it's going to take a long time. And that's one of the reasons why programs like ours need to get veterans help now, today, as opposed to waiting 3 to 4 years until we know for sure that these treatments are, going to be effective for specifically for veterans in a definitive sort of way. So anyway, that's all I'd add to that, Jared.
Thanks, Ken.
Sure. Nico, other questions before we forge ahead?
Let's forge ahead. Let's cruise through the rest of this content, and then we'll dive into questions as we have time at the end.
Yes, sir. Here we go. So veterans, I'm going to take the lead on this one because I am a civilian therapist and I understand this very deeply. Veterans have a difficulty developing trust. They're concerned about us. They fear that we're going to judge them. They don't trust authority figures because of some of the traumatic experiences that they have had, and they may see you as a therapist as such an authority figure, right? There's related guilt and shame about what somebody may have done in the military that they find difficult to disclose to somebody who hasn't had that shared experience, right? There's stigma associated with coming forward with a mental health issue, which particularly in the military, which can it can adversely impact your chances of promotion, for example, if your commanding officer finds out that you're doing it and you're an active duty person, right? People have had negative experiences with counseling. There's some really bad counselors out there, and they may have had an engagement with them that really soured them on the whole thing. And then they're also concerned about privacy and confidentiality with good reason. Again, active duty folks, they don't have any assurances of privacy and confidentiality because the information may well flow back up to their commanding officer, who may have some adverse consequences for that individual, right? So just practical tips is like create a safe environment for that person, right? So be predictable, set good boundaries, have your demeanor be kind of appropriate to and matching what they're coming to the session with, and create a calm and say, oh, it's holding space, isn't it? Right? It's establishing psychological safety is really holding space, right? Be transparent. Like I've been trying to model that as we go through here. I am a clinician. I have a lot of experience, but I have many blind spots, and I need to learn each veteran's story in order to best help them. So be transparent. Explain what you're doing. Don't rush. Give them time to tell their story. And yeah, let them know that mistrust makes sense. Like you can understand why they're mistrustful for all the reasons I just laid out, right? And as Jared's mentioned before, the bullshit meter is highly sensitive in veterans. If you start to shine them on, if you try to pretend you're somebody you're not, if you pretend that you know things you don't know, they're going to call you out on it, or more likely, they're just going to stop seeing you, right, and not get the help that they need. So, Jared, you want to add anything on trust here?
No, I think you covered it really well. This is one of the reasons why Heroic Hearts tries to pair veterans with veteran coaches, is because that level of trust is easier to establish when they know that someone knows what they're talking about or where they're coming from. Not all of our coaches are veterans, but the ones that are not veterans have as I would say, speak the language of veteran, so they understand and can work with those veterans on a one-on-one level. So trust is super important. If they don't trust you, they probably won't work with you. And if they do still decide to work with you and trust you, without trusting you, that can cause some issues within the ceremony space or in the clinical space when you're working in the psychedelic with them alone. You don't want that for anybody at that point. You want to feel like they're comfortable asking for help or needing assistance in the space.
Thank you, Jared. I'm going to move on here. Here we go. Understanding the military context. I'm going to turn this over to you, Jared, but just to make some introductory comments. The context that the trauma happened in is really important, and it's really different than the trauma that may happen in the civilian population, right? Because they're operating according to different rules of engagement that are profoundly different from the ones that us as civilians operate, right? So, Jared, do you want to riff on this for a little while?
Yeah, so that's really important because that gets into other topics which are next on our line about moral injury, especially about like where they felt like their actions were justified in the context of these rules of engagement, especially when they're on deployment. But something that I found interesting was that when Ken and I were making this slide, we were looking at it a very just to talk about what we just said about like the context of where the trauma may have occurred and everything else. And something dawned on me, and maybe other veterans in the room can understand, is that like these rules of engagement were drip fed and sometimes force fed into us throughout our entire military career. And then I started to notice that even as a civilian, when I got out of the military, that these were how I were working with my emotional state as well when it came to how do I approach threats when someone's coming to me, and not necessarily going into deadly force, but when do I shut down? When do I get aggressive? When do I start pushing back? When do I do these things? I start feeling like someone is pushing in on me emotionally, then I will ramp up my energy and get more angry or other thing else to push them away to protect myself or to protect others in the room, so to speak, if that's what I thought. So this was something that I found was really interesting as far as the rules of engagement going into being a veteran, is that like this type of energy exchange is something that they carry with them outside of the military, and they start kind of applying it back into their home life, into their work life, into their social life, on an emotional and not just a physical level that we're seeing here.
Thank you, sir. Moving along here, moral injury. Moral injury is commonly associated with military personnel because they may feel responsible for harming other people or failing to prevent harm, right? So some of the events that, the examples of events that could lead to moral injury include killing other people, making decisions that affect survival of others, like people in your unit, right? Being unable to care for all the people who may have been harmed, or freezing or failing to perform a duty during a dangerous or traumatic event, like falling asleep on patrol, right? Failing to report an event that violates rules, or engaging or witnessing over-the-top violence. So it's doing things, ultimately it's doing things that that go against your value system, and you do them. It's related to what Jared was just telling us about around the military rules of engagement. But yeah, it's doing things in that situation that make sense and are following the rules of that game, but don't match up with your value system or your sense of ethics, and that can cause really significant conflict. Jared helped me appreciate the practical tip here. Is like, it's the distinction between feeling like you're a bad person or somebody who experienced a bad thing, right? So as a psychologist, we talk about that as attributions, right? You want to change your attribution from me, I did this thing, to this situation that I found myself in. I was doing the best that I could in the situation that I found, following the rules that I was taught to follow, right? So we're going to plant the seeds of reattributing things during the preparation phase, and then help them, use have the medicine experience, bear the fruit of those seeds that were done. So, Jared, what else do you want to say about moral injury here?
So one of the questions that they ask us in the military, especially before we go into like for me in the infantry, are you a conscientious objector? And for those that don't know, is that's someone who is basically morally and adamantly spiritually opposed to violence or even holding a weapon, for that matter. And if you are one of those things, you probably won't do well in the infantry. So some people are not that far on the spectrum, but throughout the military, you are asked to do all kinds of things that may be well beyond your moral compass of what you feel is right and or wrong. But that mission first mentality comes in there, and you are still required to do things that may not be something that you would morally agree with as a person, and then maybe even just be participating in something on a grand scale that you don't morally accept or agree with, but you are in it because you are a part of the military and you're part of this structure and everything else, and you have no choice, or you will have reprimand. So this kind of moral injury is it can be very broad. It could also be very small. But what we're coming down to is just like what Ken said, is we're looking at shame versus guilt. And as a coach, I like to think of it as that. As the difference between shame and guilt is that shame says, I am a bad person because I did bad thing or participated in bad thing. Guilt is saying that I'm not a bad person, but I participated or did said bad thing. And those distinctions are really important to look at, because if you are saying that I'm a bad person because I did a bad thing, that's a never ending feedback loop that you are stuck in when it comes to your actions or things that happened in the past. Guilt is something that you can look at, learn from, and build upon and move forward from. Guilt still hurts, shame still hurts, but guilt is a productive feeling that you can move forward with and use to your advantage, saying, I won't do that again because I feel guilty. But shame, again, is labeling yourself as the problem, not the action as the problem or the situation as the problem. And that really helps the veteran to move through that. One of the things that you can't do this for the veteran, because some of them have been struggling with this for years, but you can plant these seeds of retribution during the preparation phase. So as a coach, we talk about these things and kind of get into how they're feeling about stuff. And then you can maybe even plant some seeds that may represent that shift from shame into guilt, that they can kind of chew on or look at as their intention as they move into the psychedelic space. And then if they are open and willing enough during the psychedelic experience, it can bear a lot of amazing fruit that you can harvest during integration period. We can't hear you. And we'll give him just a second. And if he can't get it back on, I'll lead it from here.
Can you hear me now?
We got you.
Awesome. Yay. I'm so relieved. All right. We're moving fast here, folks. We got the last 20 minutes, and we got about 5 slides to go. So bear with us. And I'm going to speed through some of these just in the interest of time, right? And you will have access to these slides later, so you can kind of dig into them. But moral injury overlaps with PTSD, but it's not the same thing, right? So moral injury is the acute distress you experience when you feel you violated your moral or ethical standards, right? Just like we were talking about. But it often occurs in situations where somebody's involved or witnesses something that affects their core values, like we said, right? One of the things to remember about moral injury is like people are making decisions about bad or worse options, both of which aren't aligned with their values and identity, right? So they have to make a bad decision, and there's deep pain, grief, and shame that comes along with that. You can see just in this little Venn diagram here that the moral injury is not, we've talked a lot about PTSD. I'm not going to revisit that. But just that moral injury is not a DSM diagnosis. It begins with an event that's witness, perpetrator, or learned about that goes against their beliefs. That's kind of the core thing, right? Is like this goes against your values, your ethics, your beliefs, and that causes you all sorts of internal struggle and challenges, right? And it's more strongly associated with emotions that are developed after the event, like guilt and shame, like Jared was just talking to us about. So be aware that there's overlapping symptoms between PTSD and moral injury. Moral injury can be a way to help kind of expand on your understanding of what people are experiencing in terms of their post-traumatic response. And yeah, just be aware that that people in military service have to make really difficult decisions, which have serious consequences for their mental health moving forward. So I think that's it, Jared. Anything else on moral injury PTSD? Okay, we're moving forward. Survivor guilt. This is another big one that we want to make sure we cover with you. It's a form of distress that's experienced when you survive a traumatic event and other people don't. And the problem is that you may experience guilt that you did not save the person, that it should have been you in that situation that was traumatic and may have caused death or injury to one of your kind of brothers or sisters in arms, right? So when other people die, you may be left feeling guilty that it wasn't you. And people struggle with the notion of being spared when their comrades were lost or died, right? So practical tips here are really to help them tell their story. You see, that's kind of a theme that we've been building throughout our talk today, right? What's the story that's keeping you trapped? What is this? This kind of aligns with cognitive processing therapy and working on the cognitions, right? Is like ask lots of questions and challenge the story, the narrative that you've developed for yourself may not be accurate. It may have some core beliefs that are really just dysfunctional and not realistic, right? So we want to help change the feelings of thought to guilt.
That's what Jared was just explaining, right? I'm not a bad person. Bad things happen to me. I'm not a failure. I'm generally a success, but bad things or adverse situations cause me to have challenges, right? Again, we're planting the seeds of reattribution during preparation, much like we did with moral injury. And it's up to them to experience the medicine and harvest the fruit of the seeds that we plant during preparation. But it's kind of related. You could see why we present them next to each other. Moral injury and survivor guilt are kind of related to each other, but they're really important issues in working with veterans, and we wanted to make sure that you're aware of them. Jared, anything to add on survivor guilt, sir?
You covered it really well. I got you. So you covered it really well there. I'm echoing on your end. Thank you. So you covered it really well. I just wanted to just reiterate that that they may seem similar as far as like our practical tips for this, but there are some nuances there. But I do want to say that we as practitioners or people who are holding space, we're the only ones that we can plant some seeds, but it's up to the person to be able to move through this on their own. I found that when it comes to survivor's guilt, that I don't like the word guilt in this because it goes back to this. I think it's more shame. I think they're feeling survivor shame. They're thinking that they're a bad person because they did something or they didn't make it through the combat experience or something else happens. And this experience can happen to veterans after losing a friend to suicide as well. It doesn't just happen when they're in combat. It can be outside of the military or anything else along those lines. It's a very common experience that goes through people's minds in these kinds of things. So for me as a coach or as a facilitator, one of the things I hope that comes out of their experience is a reframing of their story of wanting to live for the friends that they lost, as opposed to that they feel like they're doing injustice to their own life by still being alive through the situation that they're in. So that's all I really want to put on that, Ken, and you can unmute yourself now.
I am hopefully unmuted. Moving forward, folks, disability. I'm going to just kind of breeze through this one because we touched on it, more than touched on it. We really talked about it, right? Jared did. Disability is a complicated issue in amongst veterans who are seeking benefits from the VA, right? So service connection is the word that they use to describe the relation the experience you had during the military caused the issue, illness, or condition that you're experiencing, right? Veterans have to establish that service connection in order to get benefits. And the thing and it's really hard and long as a process, as Jared described. But what I would kind of emphasize here is that disability, people may be attached to that identity as a PTSD veteran or attached to their disability. And they may do psychedelic work with you and their identity evolves and they are able to move beyond that. The VA still, this may work against them in terms of getting the benefits that they deserve, in that the VA could say, well, you're all better. Why are we going to pay for you now? You don't have PTSD anymore, right? So it's just something to be aware of, that there's some sort of perverse incentives going on here that may cause people to hold on to that identity really tightly because there's money involved and they're going to get the benefit if they're able to retain that identity as a veteran with PTSD. I just add there that it doesn't matter if the trauma is service connected or not. Ultimately, in the work that we do, right, it's trauma, and much of the trauma that occurs to veterans happens during their childhood or their formative years, right? So let's not forget that trauma doesn't just occur during combat or military sexual trauma. The people who enter the military have often experienced traumas due to a variety of adverse childhood experiences or experiences as an adult. So anyway, just want to, there's some first incentives here. Be aware that disability may cause an attachment to a PTSD veteran identity that can get in the way of your work. What else do you want to add, Jared?
You got it. That's good.
Nailed it. All right. Last slide before we wrap up, which is a really important one, is readjustment. So making the transition to civilian life is incredibly difficult for people to make, exceptionally difficult, right? And in part, it's because people have had a sense of belonging and camaraderie and purpose for many years during their military service, and that goes away when they're done, when they're discharged, right? So some of the experiences that they may have are feeling isolated or losing their sense of identity or purpose, losing their community. They were part of a larger community and now they're alone, and that is super challenging to deal with, right? They may lose their sense of self-worth, which was attached to their identity as a military service member, right? And so there's working with veterans of different eras of service. We kind of touched on that, and issues around the deployment life cycle. So think about, the readjustment period may happen over and over again as people are deployed and come back, that they may have similar experience, right? Veterans are often high performers, which can help and hurt your psychedelic work, because they're trying really hard and maybe not having space for the medicine to do its thing. And I don't know, Jared, you want to, before we get into practical tips, anything else you want to add? I'm sure about readjustment.
Yeah. So readjustment, I kind of even covered it in my personal story. It was the one of the hardest, if not the hardest, transitions in my life. It Ken and I actually kind of joked about this picture here. It doesn't really do readjustment well because it kind of looks like you're going from college into a career field. I said that if it looked average for most of the veterans, it would also have this big gap in the middle where they're like they're going through a divorce, their house is on fire, they feel detached, they have this big gap before they even feel like they can function well in that. And something that I like to put into the standard even for veterans or for people to understand is that a lot of veterans don't make it out of readjustment period alive. A lot of us don't go through that period and make it out. So it's something that we need to be mindful of, especially when they're coming out of the military and then going into working with psychedelics, about that kind of period of time and where their stability is currently at in their life and how we can help adjust that or to be of support of that.
Here. Thanks, Jared. So yeah, we talked about identity. I think one of the antidotes to readjustment challenges is not a cure, but is giving people an opportunity to connect. I think that's one of the reasons why our program is so powerful, because people do connect with one another and they're able to maintain those relationships after their psychedelic experience, right? And we may need to deprogram them, which is a interesting word, but some of the things that the military taught them about this brings us back to the beginning when Jared was talking about military veteran culture, right? That if you're always the protector, that can get in the way of you doing the work on yourself because you always prioritize others. So I think with that, I'm going to wrap up, and we have 10 minutes for questions, which I'm proud we made that. Road ahead here for us is like, let us know. Jared and I want to do a roadshow. We want to let people know, like, we want to get the word out about working with veterans and sharing this information we shared with you today. So if there are psychedelic societies, professional organizations, local, national, let us know. We can talk about giving this presentation or some portion of it to the folks that are in training in your program or elsewhere. Come to our website. That's heroicheartsproject.org. Particularly if if you know of a veteran or you are a veteran who needs help, you can access our intake process through the website. Visit our booth at Psychedelic Science. If any of you are coming, come by. Jared and I will be there. We'd be happy to meet you and talk about this stuff or anything else for that matter. And buy our book. We have the Veteran's Guide to Psychedelic Journeys, as well as a Therapist or Coach's Guide for that, is available on Amazon. And we would encourage you to have a look at that. And I believe it's still available for free download on Kindle, but I may be mistaken in that. So do that. And finally, and if you feel called to do so, please offer some donations. We welcome those in supporting the work that we want to continue to expand doing with the veterans that we serve. So with that, I'll wrap it up. Any parting words, Mr. Reinhardt?
I just want to say thank you to everyone that came. And I'll mute you, Ken. So Everyone that came today, I just want to say thank you so much for attending this. This is kind of a dream come true for me, and also kind of weird because I didn't expect it ever to our organization to grow the way it did. But because of the awareness and what we're doing within the psychedelic space, we've been able to assist veterans in finding some really amazing healing within their own lives. And just seeing the amount of people that are on this call today and knowing that you too are interested in helping veterans, and not just veterans, but people heal with these medicines, that just is amazing for me to be a part of. And I hope that I get to at least meet some of you at Psychedelic Science, or maybe connect with you offline in a different sense, to maybe collaborate in certain ways with Heroic Hearts Project. You're muted again. I muted you.
Thank you for muting me. I'll unmute myself. Yeah, Nico, we have 5 minutes. Any burning questions that got upvoted that we can address?
Yeah, absolutely. If you would, and sorry. I got you. Okay, so question number one, there's a couple questions related to this, but it's around training. Obviously this is the training course that you just went through with us, but what are other training programs, certifications that are trusted that you would recommend, especially for working with these populations?
What do you think, Jared?
So when it comes to psychedelics, you're gonna have to mute yourself every time he's done talking, Ken, because it echoes every time. So when it comes to psychedelics, there are so many different organizations or training courses you can go through. There are also some places that are just trying to make a buck and give you a certificate at the end of the day. When it comes to Heroic Hearts, with working with veterans, say if you want to be a coach or a facilitator with Heroic Hearts, what's most important to me is that you have gone through some robust training of some kind. When it comes to integration coaching, and also when it comes to facilitation. So if I look up the course that you say you've gone through and it's only like a 2-week course and you got your certificate, probably not going to want you to be around veterans. But if you've got 10 years of facilitating experiences with reference, then I may be able to look into helping you with that. So I think there's a healthy mix of personal experience within the space, whether that be legal or underground, and also with doing courses. So one of the courses that we work with for integration coaching is Being True to You. We also work with coaches that have gone through the Vital course. We also work with those who've worked with the Psychedelics Today course. So there are all kinds of different courses that I would say would look good on a resume to work with Heroic Hearts Project. But there's nothing that Heroic Hearts Project at this moment recommends that people go through, and we're working on one of our own that may be able to help.
Yeah, very cool. I'll just put in a plug here at the end. If you're in a training program and you would like to bring in this content and have Jared and I kind of address your folks, let us know. We'd be happy to do that. And clearly, our mission is to get the word out about how you can best help veterans, and that's one way to do it. One more question, Nico?
Yeah, there's a great segue that Jared, you brought up there around integration. And so the question is, what kind of integration support do you provide to your clients?
Perfect. I can answer that very well. So for those that don't may not understand, I will tell you, I'll preface it with this. There is no real integration without real preparation. And what I mean by that is you're setting the seeds up and for the process of the psychedelic experience, and then integrating what you learned after that. So with our veterans, we do a preparation period. They have group calls. They have 3 group calls about 90 days prior to they go. Not 90 days. I'm sorry. About 3 weeks prior to them going on retreat. And then during that period, they also have integration calls with a one-on-one coach, where they go and they have their own personal session with a coach, where they dive into their intentions, their issues, what's going on with them, how they can help, what they want to get out of the psychedelic experience. Then they go on their psychedelic retreat, and then they come back. When they come back, we start the same process over again, where we start doing group calls with them, where they start doing group therapy together, and they learn about their experience. They talk about what's going on in their own integration, what their strengths, triumphs are, and they also keep going with their own individual personal coach. If they do need more support, we offer them extra sessions on top of those sessions that they have weekly or bi-weekly with their coach after when they get home. So this can extend up to 3 to 4 to 5 months with a client, depending on how much they need support going on that. as well as helping them connect with the SOF community to help with getting them assigned with a therapist. If they did uncover something that is outside of the scope of our coaching, we will assign them with a therapist that we've helped them to connect with in their own area. So integration is kind of a long process, but we try to stay as connected with the veteran as possible. And then on the very, very end of it, we have alumni calls that we do monthly with all of our anybody who's gone through our program, where they can connect together and we can talk about things and what's everyone going through and how we can assist or what we can do as a community to hold people up. So that's very quickly our reintegration program in a nutshell.
Please, I would just encourage you to reach out to us through the website, and we'd be happy to continue the conversation with you. I know the hook is coming out. I feel it. So, in terms of our time together today, I just want to thank all of you for coming and listening and learning about how to help the veterans who have served our country. And again, thank you for your attention and great questions. And look forward to continuing the conversation. Nico, any closing words? We have a minute.
Thank you so much, guys. That was great. This recording will be shared out so you guys can review it. And for questions we didn't get answered, we'll see if the guys will respond in the comments. This platform will be up and available for people to review comments in there as well. But thanks everyone for coming.
Thank you all so much.
Thank you.